And I guess I'd like to ask a question, why is he being evicted? Why? Does anybody know why? I guess I'd like to answer that question with a couple other questions. Is evicting, number one, is evicting Leo good for the community?
No.
We risk losing a doctor who's dedicated his entire adult life. His entire adult life. He went to medical school, the idea of coming back here, became the top in his field, come back here, to offer surgery to his hometown. That's been his goal as his whole adult life. Number two, is evicting Leo good for mercy?
No.
Without Dr. Leo's pay.
She's asking about whether we could apply for a certificate of need for a separate hospital. I don't know if people are aware of a certificate of need process, but that's for all kinds of medical facilities and hospitals where you have to go before the state and say, well, we would like to apply for a certificate of need. We need this service, because they don't want a whole bunch of like radiation therapy centers things. So you have to go and you have to make your case pretty strongly. You know, I think in a philosophical way we could make the case pretty easily that we should have a new hospital in Illinois, even if these jokers don't want to build one. We could say, here's all the needs that aren't being met by the present hospital. So we have a certificate of need for the needs they're not satisfying. It's a bit of a stretch, but we would go before that body and they would say, well, you've already got a federally designated critical access hospital, get out of our room. Unless we made a really strong argument and had them said, time out, hey, look at this a little bit more. But on first blush, we would be resistant. Plus, and that's where people's pocketbooks get involved, to be able to make a bona fide presentation for a certificate. It probably costs about $100,000 just to pay the consultants and the people to put it together so you have a legitimate chance. Because when you go there, of course, you'll be opposed. You'll be opposed by the Wheaton people be lined up there.
I really would feel bad and I would feel amiss if I would leave you people with all the story being untold of what we have done in the background with the state and federal government on this issue.
The employees of the hospital that work clinically with Dr. Leo, so everybody involved in the OR, all the nurses and patient care assistants, we stand behind Dr. Leo 100% because we know what he's done for the community and for the facility. I think one thing that I really think what's really going on, it isn't that Wheaton needs his space right now, but they truly believe they take his space, he will leave. So you need to ask, what is it that they're really trying to do? Kathy Hens. Okay. So that's the deal. I mean, why do we need this?